Last 18 months, there has been no respite for New Hampshire's hospitals. Burnout, fatigue, and frustration are very real as doctors and nurses deal with on a daily basis the human toll of COVID-19 that so few of the rest of us see on a daily basis. Now, on top of that, they are beginning to enforce on their own employees vaccine mandates at a time when it's all hands on deck. Here this morning to discuss that and more is Steve Ahnen from the New Hampshire Hospital Association. Thanks for joining us, Steve.
Good morning, Alec.
So I just want to take the temperature first. The slogan is we're all in this together, but really the healthcare system has been at the front of the front lines, and sometimes I bet it can feel kind of lonely out there. So how stressed are hospitals and the people who work in them right now?
Well, 18 months into this pandemic, couldn't be more proud of our hospitals and their healthcare heroes who have literally been on the front lines every day, coming in, serving their patients, their communities, and one another. But there's no question, they are tired. They've been at this every day, and they continue to show up. They continue to come in, partner with one another, work together to do everything they can to serve their patients and their communities. But I have to say, they're probably as stressed today as much as at any point during the pandemic. And that's caused because of the increase in COVID cases, but also a very busy hospital with patients who may have foregone care, missed a mammogram or a colonoscopy or other preventive service during the pandemic, and are now much more acutely ill and require hospitalization. And, on top of that, an ongoing workforce shortage that was, a challenge before the pandemic and has only become, more challenging as a result. So again, our hospitals are doing everything they can to serve their patients and their communities. I couldn't be more proud of what they're doing. In many ways, as challenging as this time is, in many ways, it's also their finest hour.
When we talk about the pandemic and when we talk about the vaccine, so often it's about the data and the numbers and the facts, which are important, but it's often kind of impersonal. As the effort to persuade the vaccine hesitant continues, do you think we're going to be hearing more about the human side of what's going on inside the hospitals, for instance?
There's no question, the science, the data, and the real world experience that our hospitals are seeing here in New Hampshire and across the country is overwhelming. The vaccines are safe and effective. And the people that are in the hospitals today with COVID-19, the overwhelming majority of them are those that are unvaccinated. And, I think it's important that we stop and think about, that ICU nurse who came to work today, for putting on all of that PPE to go into the ICU to care for their patients. They see their patients, they hear them, they're struggling to breathe, and they're doing everything they can to ensure that patient gets the best care that they can and the best outcome possible. But unfortunately, nearly 1,500 Granite State residents have died over the past 18 months due to COVID-19. And it is our solemn and inherent responsibility to do everything we can to prevent that pain and that suffering. And that's what our hospitals are doing. And that's why, all of the public health guidance is so important, from wearing a mask when we're indoors, washing our hands, getting a test, staying home when we're not feeling well, and getting the COVID-19 vaccine. It truly is what's going to lead us out of this pandemic. And I think, we just need to stop and remember, we as individuals have an opportunity to impact the arc of this pandemic, and we can make a difference to reduce COVID cases, hospitalizations, and deaths. And that's where, we need everyone's help. We have an ability to make a difference. And if we do those things, we can better manage this and we can get through this in the best way possible.
Workforce is a huge issue right now. How on the edge are hospitals at the moment in New Hampshire, Steve, in terms of having the people they need to make the hospital work, to keep those beds open to treat the patients?
It's a growing challenge, and, workforce has been a significant issue before the pandemic, and it's even, more so today. And hospitals, again, are working together. They're collaborating. They're partnering with one another to make sure that every patient can get the care they need when and where they need it. But that's going to become, a greater challenge. And, as more patients with COVID come into the hospital, we're going to do everything we can to take care of them. But, that's taking up a bed that could potentially be needed for another patient, whether COVID or non-COVID. And so, again, these are things that hospitals are working together to manage. But the challenges are certainly growing.
The hospitals are at a point now where they're enforcing their vaccine mandates. How much workforce are we going to see lost within hospitals to nurses or folks like that who refuse to take the vaccine?
We'll certainly learn more as those requirements go into effect. But the fact of the matter is the vast majority of our staff have been vaccinated, and more have been coming forward to do so because they want to be able to work in an environment where they can safely care for their most vulnerable patients. As we've seen in other parts of the country when those vaccine requirements have gone into effect, it's really been a small number of staff who have chosen not to get the vaccine and chosen to leave their organizations. I believe that's what we'll see here. We certainly don't want to lose any employee, any caregiver, but at the end of the day, our job, our responsibility is to care for our patients who are our most vulnerable citizens. And we have a solemn responsibility to do so in a way that we can ensure the health and safety of them, our staff, and our communities. So, we will certainly see some challenges, but I don't think they will be as significant as some might have projected. And again, the overwhelming number of our staff are vaccinated, and more continue to come forward.
Steve, even if it's a small number of people that are leaving because of the vaccine mandate, you talked about the human element earlier and the human story. If there's that one nurse that can get out there and gain an anti-vaccine platform, we've seen there are a lot of people who want to hear that, and so that gets kind of lifted up. That becomes a real dilemma, doesn't it? Because you have the healthcare system saying one thing, and then maybe one person leaves and develops their own following and their own message around this. It's a problem.
It certainly creates challenges, but again, I think we need to focus not just on the small minority of our staff or individuals who are not supportive of a vaccine requirement, and really stop and think about all of those individuals who have chosen to come forward. And frankly, we're hearing from our patients and our communities who are thankful that we are asking our staff to be vaccinated because they want to come into an environment where they can be helped and cared for safely and effectively.
You hinted at this earlier. What about the care that's not happening? We talk about the COVID patients and the capacity for them, but how much care is not happening in terms of the normal things that would come to the hospital where you would normally have a bed and now that's not there?
Well, again, we're working to make certain that we can take care of those patients to the extent that, we have to adjust and make any accommodations or delays. We will do that. But the last thing that we want is for patients not to get the care that they need. We certainly saw during the pandemic when that didn't happen, the significant impact that has had on whether it's, cancer diagnoses or others, where they simply weren't able to get the ongoing care that they needed. We need to make certain that we don't go back in that direction. And I think our hospitals are working very, very hard to make sure that everybody can get the care that they need and that we're not delaying care because that certainly creates issues for those patients and potential, outcomes that are not as positive.
And COVID certainly appears to be on its way to becoming an endemic illness. If we continue as we are now with, 30 to 40% of the population unvaccinated, can the current healthcare system persist in this status quo of crisis?
Well, I think the better way to think about that question is not, what can we do if things don't improve? I think we have to find a way to make improvements, to move the needle, to make certain that we can, move beyond the pandemic. We all want to get back to life as normal, or as normal as it can be, where COVID-19 isn't calling the shots. And, in order to do that, we're going to need to get more people vaccinated. We're going to need to continue to follow that public health guidance and those messages. And if we do that, and I believe we can, and I believe we will come out of this in a way where we are stronger and healthier as a result.
The financial viability, this is something we talked about, 13, 14 months ago when we last had you on the program. How does that stand right now? Do we have any fears of some hospitals not being able to make it through this?
We've certainly seen a significant amount of lost revenue that, early on in the pandemic when, non-urgent elective procedures were postponed or delayed. The significant amount of lost revenue has been tremendous. All of the federal and state efforts to help support our hospitals has been incredibly helpful and appreciated. Some hospitals continue to struggle, where they may still be in a position where they've lost more revenue than they've been able to bring in. But I think again, the efforts that we just saw this last week about the opening up of the portal for the additional federal relief will be helpful. But again, the cost of doing business in COVID hasn't gone down, hasn't gone away. The things that in terms of added costs for PPE, for staffing costs are significant. Those costs haven't gone away. So we're going to continue to need help and support as we work through this. But I believe our hospitals will continue to be there for their communities. If we've ever wondered how important that hospital is in their community, that blue and white H that we see, it is now. And the need for that institution to continue to serve their patients and their communities today and into the future could not be more important than ever before.
Steve Onman from the New Hampshire Hospital Association, thanks so much for joining us on Close Up, and good luck to you and your members out there.
Thank you.